Well, joining us live now is Dr. Kendra Marsh. She's a cardiologist with Prevea. So tell us a little bit, we're talking Heart Month. Tell us about the symptoms that people really need to be on the lookout for.
Well, this is actually Heart Failure Awareness Week, which kind of ends Heart Awareness Month. And heart failure is on the disease spectrum of cardiovascular disease. And the symptoms can be quite subtle until they become very severe. Normally people notice that they're not able to do activities of daily living, such as cooking, cleaning, shopping, until their symptoms progress. And even basic things like bathing themselves, feeding themselves, or even making their bed becomes a chore.
That's just that they're feeling exhausted, right?
Exhausted.
Okay, so what are some of the things that people can do to kind of minimize their risk?
Well, with heart failure, like any other cardiovascular disease, good health habits early on are very important. Healthy eating habits, maintaining a healthy body weight, eating a good diet. If you have diabetes, managing your blood sugars, managing your blood pressure, just being active and proactive in seeing your physician or cardiologist.
Now, what types of things, you guys are starting something super exciting for Prevea. You're doing the Heart Care University. Tell us a little bit about this.
Actually, we've been doing Heart Care University for quite a while. I find as a physician that patients who are proactive in their care and have a good understanding of their disease tend to do better. They live longer, they feel better, and they're more likely to follow the treatment plan. Heart Care University is a patient-centered program. We have 5 experts. We have heart failure experts, we have nutritionists, we have exercise specialists, behavioral health specialists, and pharmacists that devote their time to educating patients on their disease, the medications they're taking, how they can be active and productive. And we found that patients that participate in this program tend to do a lot better as far as feeling better from their symptoms and even doing better with their heart failure condition.
All encompassing, it sounds like.
All encompassing and free of charge.
Oh, that's awesome. If there's somebody out there right now who does have this disease, you know, what would you recommend to them?
Well, first and foremost, recognize your symptoms early. Never be afraid to go in and see your physician if something's not quite right.
If you just don't feel right.
If you just don't feel right. And another thing that doctors will look for, especially people that manage heart failure, are signs of water retention. So swollen legs, swollen belly, which is a sign that the heart, which is supposed to pump blood throughout the body, just isn't able to keep up with the job or the demand.
So somebody watching out there who might be noticing these symptoms of swollen legs, they're getting really exhausted, they really need to go in and talk to their doctor.
They absolutely need to go talk to their doctor, because we know that with early intervention and aggressive evidence-based medical therapy, patients can actually do well, and some people can actually improve the strength of their heart muscle.
Awesome. Sounds great, Doc. Thanks so much for being with us. There is more information about heart health and the Heart Care University and how to get signed up for all those classes. It's all on our website, NBC26.com. Just click on the Wisconsin Tonight tab. Well, trending tonight.